One issue that we're seeing highlighted is the funding issue. So having short-term funding cycles, that limits the infrastructure that people can have available, that limits the offers, and in turn that limits the confidence in people being referred in. So when we look at long-term funding, what we're hoping to see as a positive way forward is a shared investment fund, having longer-term multi-year commissioning offers, also having consortium of providers coming together so they can share resources. Because what we're seeing within the Green Social Prescribing practitioner side is they're juggling loads of different hats. So they're not just delivering, they're also doing safeguarding, they're doing supervision, they've got to do HR, they've got to put in applications for the funding. So coming together as a consortium can also help tackle some of those barriers. In some cases, we're seeing that nature practitioners are not being best supported, so they maybe haven't had suitable mental health training or training specifically about a long-term condition or how best to support access needs. Addressing those things going forward will be really key, and that will in turn ensure that clients who are being referred into social prescribing activities get the best benefits coming out of that because they're best supported, but then we'll also have our workforce best supported.
You as a practitioner, you have your own reactions and responses and mental health issues. Everybody has them, just some people are more aware of them, they have greater impact on people. But it's actually being able to contain somebody's emotions and not respond with your own emotions is really important, and it's a really difficult skill, but really important.
Building the capacity in our providers and the workforce, both in terms of their skills around nature-based practice, but really their sort of market-ready skills around evidence, comms, income streams, policies, safeguarding, governance, all those sort of things, really, really important to having a robust sector that can engage with the public sector and the big beast that is the NHS.
Partnership has been key and central throughout. We've worked with a community interest company called Positively Empowered Kids, and they very much played like a bridging, connecting role. They have really established themselves within young people's services. So they are familiar faces to the youth club members, and they allowed us then to be able to connect with that group.
There will be medics, GPs, people in a clinical setting that have been working in this area, and equally there will be environmental community organisations in the localities who've also been doing this work.
We've convened both online meetings and face-to-face meetings of other green providers, sharing learning and problems and challenges that we've all been experiencing. We did a lot of work with all of those stakeholders to kind of understand what landscape we were looking at and what some of the issues were, some of the barriers and enablers to more green prescribing happening. And then we co-designed the programme priorities with those stakeholders. So what the programme did was shaped by a broad range of people and the stakeholders and different organisations.
We've encouraged groups to include the costs of producing evidence in their funding applications, to recognise that it takes a bit of time and capacity to do that kind of work.
It's nothing more heartbreaking than funding a brilliant intervention and only 2 people turn up. So actually getting your comms really strong is important. We've done that through things like our website, we've got a directory of all our interventions, and we have localised maps which show the interventions in a very local area. So we've had immersive taster sessions where we get the practitioners, whether they be GPs, link workers, mental health workers, a whole range of professionals, to actually come out into the green spaces and try the interventions. If you've seen something work and experienced it yourself, you're much more likely to actually refer someone else into it.